Are we ready? Ready to rock and roll? Not yet. Thank you. Good morning, everybody. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, October 18th, 2022 at 8:30 a.m. First item is to approve the consent agenda, which includes our meeting agenda, our minutes, and financial report, and abstracts and bills. Any item a member would like to pull from the consent agenda? Else I'd entertain. Is there any changes to the agenda? No. I'd entertain a motion to approve here.
I'll make the motion.
Thank you, Commissioner Svaleson. We have a motion. Is there support?
Sullivan supports.
Thank you, Commissioner Sullivan. Motion and support. Any further discussion? Hearing or seeing none. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. That moves us right down to the introduction of new staff. Hand it over to Allison, if I may.
Very excited this morning to be welcoming two members to the PHHS team. Matthew Baxley joined us earlier this month as our coordinated mental health response worker, coming back to the department after a hiatus. We're really excited to have Matthew on board in this role. It's a new, innovative program. Matthew spent the better part of the week last week in Duluth, connecting with similar programs and learning a lot from the crisis intervention training team in Duluth. So really excited to have Matthew back on board.
Yeah.
And then Laura also joined us recently as our in-home support coordinator and adult services social worker. Laura's been with us several weeks now and is connecting with service providers and service recipients and digging into file maintenance and learning a lot. So we're just really glad to have both of these professionals on board.
Very much so. Thank you both for joining, and very exciting for you to be back, Matthew. Thank you. And Laura, that's my sister's name as well, Laura Nelson. So
There you go.
That's pretty great. You kind of look like her, but not enough for me to get confused. So, any comments or questions from anyone on the board?
No.
Welcome aboard.
Commissioner Hopkins.
I'm wondering if you'd be willing to tell your background and why you were here in Cook County. And yay, you're here, but I just want to know your background.
Sure. So I just moved up here from Minneapolis in June. So I'm new to the community. But I have a background in nonprofit administration in the cities. And I was very interested in working for the county to become a part of the community more. And this program was really exciting and interesting to me, and kind of things I can pull from my past experience, and also I'm learning a lot. And yeah, this week I'm just starting to actually meet with people in the program, and it's really exciting. So
Thank you.
Yeah, and I'm biased, but I think it was a good move for you. Thanks for joining the team. Anybody else have any questions? All right. Well, welcome and thank you both.
Can Matthew?
Oh, I'm sorry, Matthew. Yeah, we've met before, but I'll allow you to introduce yourself as well.
Yeah, thank you. I'm not new to the county. I've been here a little over 7 years and worked in mental health prior to my move up here, and then had a stint here working for Human Services, getting my community support position up and running for a couple of years, and it's exciting to be a part of getting new services constructed and available to the community in ways that have to be innovative and sort of problem solving. And this is certainly another example of that. So it's really looking forward to figuring out how we can offer more to the folks that need things here that we're still trying to figure out how to provide.
Yeah, may I just, in a nutshell, what Matthew's role is to coordinate daytime services for people who are experiencing crises, who might be contacting law enforcement or the hospital. And just, those are such distinct systems. They do not overlap hardly at all, except for that individual and that person Matthew's job will be to learn about the systems and integrate the systems so that everybody has a better idea of how to move forward, and it's less stress for all the systems. So it's daytime coordinated response, and it's based on some models that are springing up all over the country in response to a lot of needs and the desire to have mental health response embedded into law enforcement. And so that isn't exactly what Matthew's doing. We're doing our own unique hybrid version that fits for our needs in our community based on our resources. So we're just a huge step forward for the community. We have a night, we don't plan to start anything immediately. There's a nice learning curve, a lot of information gathering, a lot of relationship development that has to happen first. So hopefully by the beginning of next year, we'll have a little more concrete information to share with the board. But just this is a big step forward for our community and really lifts up the law enforcement team. They're very, very excited about having this position, and the hospital emergency room is very, very excited about having this position. So really community building amongst all our partners.
Yeah, well put, and thanks for that summary again. I know we've talked quite a bit about this position and the real need for it, and some of the similar positions in some partner counties in the region and how well that's working, and certainly it's going to be very challenging to get it all up and going, and just really appreciate your willingness to take that on, and then just the help it'll bring to our community members and also law enforcement and the hospital. I mean, we all know how much burnout is happening, and I really think if we can communicate more and work better together, that it's going to help with that too. So thank you very much. All right. Well, have a great day. Thank you. That moves us down to item 4, the staff report. Good morning.
Hello.
Morning.
Hi.
Good morning.
Keep my mask on. So I'm Andrea, public health educator for Cook County Public Health, and here to talk about our Healthy Homes initiative. So thank you for inviting me. First, I'm going to talk about the principles of Healthy Homes, and then sort of the process that we went through to create the program, other work associated with the grant, the assessment process, some highlights, and then some highlights of the assessment. So this is a grant-funded project through the Minnesota Department of Health with on-the-ground work performed and coordinated by our local public health agency. So the 8 principles of Healthy Homes is to keep it dry by preventing water from entering your home, keeping it clean, which is controlling sources of dust and contaminants, reducing clutter. Keep it safe is storing poisons, chemicals, medications, and firearms out of reach of children, securing loose rugs, installing smoke and carbon monoxide detectors, and keeping fire extinguishers on hand. Keep it well ventilated is ventilating bathrooms and kitchens to use the whole house ventilation to supply fresh air to reduce the concentration of contaminants in a home. Keeping it pest-free, sealing cracks and openings throughout the home and store food in pest-resistant containers. Keeping it contaminant-free is reducing lead-related hazards by fixing deteriorated paint, keeping floors and windows clean, test for radon in a basement, and keeping your home well-maintained. Inspect, clean, and repair your home routinely. Take care of minor repairs and problems before they become larger concerns. And then the last principle is thermally controlled. Houses that do not maintain adequate temperatures may place the safety of residents at increased risk from exposure to extreme cold or heat. So those are the 8 basic principles that we use to create the assessment. Through the planning process, we had to research other healthy housing initiatives and evidence-based assessments. There are a lot of assessment options out there, and taking all of those examples and creating one that fits for our rural county was a lot of research and pulling information together. I, myself, attended a number of virtual trainings on lead, hoarding, fire safety, and other healthy home-specific trainings. Grace and Andrea and I attended a Healthy Homes practitioner training at Sustainable Resources in Minneapolis, and that was a 2-day training that really just taught the core basics of healthy homes and helped provide resources and examples to, take it out into the community. We finished the creation of the assessment, and then we created a process for the referral or request of the assessment, the follow-up procedure, and then the criteria for the financial support for mitigation costs, and then all of the associated documents, which includes a referral tracking sheet, a follow-up, the assessment report, which the person receives after we do the assessment, the follow-up form to make sure that, all of the whole process is followed through in its entirety. We then practiced the assessments at each other's houses, which revealed a lot of information about how the assessment was built, because you don't really know how smoothly it's going to work until you go through it. So that those practices, created a lot of revisions to the assessment itself. And then we got the Healthy Housing Network group off the ground. And so far, this group has met twice. The recordings are on the county's YouTube site. And in that group so far, we've created a mission statement for the group, which is, the Cook County Healthy Homes Network builds on the established capacity and expertise of current local programs to improve the health and quality of life of all residents by compiling and providing educational and financial resources to reduce common housing-related health and safety hazards. So we established that, and then that group also provided feedback on all of our forms and processes that we had in place. And then at our second meeting, we began the creation of the of a service map for local educational and financial resources, which is a portion of the grant requirement to make sure that we have resources available locally and, through other areas that homeowners and renters can access for further resources. Let's see. So other work related to the grant is that we have to do 4 elementary aged educational presentations by the end of the grant cycle, which is June of 2023. So I'm sort of in the process of compiling resources for that and trying to pull some of that information together. We have 20 assessments to complete by the end of June. And then we also provide monthly educational information to the community through social media. And so far, the topics have included children and lead, 7 tips for healthy housing, pregnancy and lead, pest prevention, fire-wise information, summer savings tips, and safe gun storage. So the next thing I'll talk about is the assessment process itself. So it starts with either a referral. So far, the referrals that we've received come from PHHS or Veterans Services, or people can request it themselves. And then we do an intake call where we gather preliminary information and talk about the eligibility for the financial mitigation dollars, and that written into the grant, we can provide up to $750 per household to help with mitigation, depending on what their priorities are, if with financial requirements. So we're using the standard WIC, SNAP, Medicare. There's a whole list of them. And that's all I remember. Okay, so then we go and after the intake call, we gather that preliminary information, and then we schedule the assessment. And the assessment process from start to finish is about 2 hours. So the homeowner has a chance to ask questions and make sure that, they have all of the information they need. And then once the assessment is completed, we have an assessment report that we complete with all of the hazards outlined, including photographs if they consent to the photographs. And then once the assessment report is completed, we take it back to the homeowner and we review it with them, homeowner or renter, sorry. We review it with them, and then they can prioritize what, what mitigation they would like to start with. And then we provide educational materials and any other assistance that might be available to them to help, do mitigation beyond what they might be eligible for through the grant. And then there's also a 6-month follow-up phone call to see if, they completed any other mitigation, if they had any additional questions that they didn't reach out for yet. The assessment itself is like 36 pages long, so it's very thorough. So what we do is we look through every area of the home unless they request otherwise. When we do the intake call, we ask if there are areas that they don't want us to go into. And what we're looking for is lighting, possible areas for injury, lead, water damage, mold, pests, unsafe extension cords. We have a child-proofing checklist we can help people with, or a aging in place checklist. We check water temperature. We talk about safe gun storage, safe storage of medications, chemicals, cleaning supplies, and pesticides. We look for dehumidifiers, smoke and fire detectors, fire extinguishers, carbon monoxide detectors, properly ventilated exhaust fans in bathrooms and near combustion appliances. We look at railing safety, and we do some minimal fire-wise sort of assessment. Part of the planning process, I met with Elsa, and she did she showed me what they do for fire-wise assessment. So what we look for is a visible fire number, emergency vehicle access, and then we talk about ladder fuels and spaces where embers could possibly ignite if there was a fire. And additional testing that we do or is available is well testing, radon testing. We have a hoarding scale that we can talk through with people if that's something that they're interested in, which then, involves other people because that's larger than just a healthy home. We have an aging at home checklist, and then we also can connect people with Elsa if they have more fire-wise questions. And the last thing that I have to say, I guess, is that our go live date for the program was Monday, October 3rd. And we have 3 assessments scheduled in the coming weeks. The first one's today, so yay. I'm trying to schedule them on Tuesdays so I can help facilitate the well sample drop-off at Arrowhead in case people have transportation issues. That's the healthy housing assessment in
36 pages.
In 36 pages. No, this is only 3 pages.
Oh, okay. That's very comprehensive.
Right.
Very impressive, and just knowing how big of an issue housing is in our community, I think this is a really important program. And I know of numerous homes that have concerns on that list, and I'm hopeful that this program can help facilitate addressing those concerns. I had a question just about how it works with renting and property owners. Like, clearly there's, the need to communicate with both parties.
Yep,
and,
yeah, so it kind of depends on what mitigation it is. If it's something sort of low-hanging fruit, like fire extinguishers or something like that, even smoke alarms, we can just help with that. But if it's larger issues, then with the renter, and we would work together with the renter and the landlord.
Mm-hmm. Thank you. Sorry, Pat, go ahead.
No problem. Thanks, Andrea. I think it's something we could all use, quite honestly. It sounds pretty comprehensive. However, though, the question I have is, you might have covered this and I missed it. Does the grants have funds to help people then do the mitigation that they need?
Yep, so we have up to $750 per household if you meet the financial requirement, which is, we sort of tried to keep it as, as accessible as possible. So it's like SNAP, WIC, medical assistance, free and reduced lunch.
That's a good list, yeah.
Medicare.
Medicare,
Yeah.
thank you. Yep. Yeah, and if you are interested in seeing at the assessment itself or any of the forms, I can send them out. I didn't feel that this was PowerPoint worthy because you don't get much of an idea on forms if you just see a picture of it. So if you would like to see any of them, let me know. I have plenty to share.
And kind of working off of Pat's question, I mean, do you see opportunities to work with AUA at all through this process?
Yep,
Yeah.
so Amy, and I don't know how to pronounce her last name, I'm going to say Amy from AEOA is on our Healthy Housing Network group.
Great.
And so is Jason from HRA. We have a lot of community members. We have the sustainability coordinator for the city, C-CLEP?
And C-CLEP, Cat Mayo.
Yep, Kat. And I'm sure I'm forgetting people, but yeah, we have a well-rounded group of people. Anne is also on it. So yeah, it's our first couple meetings have been very informational, and like people are pulling together resources really quickly. So it's really nice.
So beyond the $750, there are other opportunities there.
Yeah, yep, and that's sort of the purpose of that Healthy Housing Network group, is to be able to have all of those levels of expertise to pull those resources together so we can provide that locally to people.
Mm-hmm. Thank you. Other questions?
It's just a really exciting collaboration between a lot of organizations that already exist and wanting to do the best for our community, and that's, I think, the great strength in it.
Yeah. Commissioner Hawkins.
Yeah, thank you. At the HRA, we talk about, we need to preserve the housing we already have.
Right.
In addition to looking at new opportunities. So this is something that we do need to make sure we're looking at.
Yeah.
So the $15,000 in grant money to do mitigation, $750 per household, is that in addition to the grant that we received to implement this program, or are we just talking 15,000? We got a grant for 15,000. In my head, I was thinking
it's built into the grant. The mitigation dollars is built into the grant that we received.
So when I looked at this budget and it said healthy housing revenue 15,000 something, wasn't it? 15,000 of that is set aside just for grants.
For the $750 mitigation dollars per
Okay.
household. Is that right? Yeah. Yes. Good
Okay.
job. Go me.
I thought it was, when I saw it in the budget, and this, just me, when I looked at that, thinking it was, we're getting this to implement this, and it was additional monies we were going to get to give out for mitigation, but that is not true. So thank you for clarifying that in my head about where
Yeah.
those revenues are going.
Yeah, and our hope, since we have gone through this whole process, our hope is that, we'll be able to find funding to continue it because it's been a process, and it is really great. At least I believe it's really great. I'll find out for sure this afternoon.
Well, and I know in my meetings with AOA, there have been challenges to coordinate and get the services that are needed. And so having more local options, I think, will really, and local communications will really help with that process, and hopefully kind of bring some of those barriers down.
Yeah.
Administrator Yorkie.
Thank you. Well, first of all, Andrea, thank you, and Grace, thank you for doing this work.
And Andrea.
And Andrea, thank you. It's just, there's so much, just one assessment can reveal some really critical issues that need to be addressed. And thinking about the multiplier effect of doing this work and potentially preventing a kiddo from, ingesting poison or running across a firearm or something like that, that's huge. And if you weren't doing this work, nobody else would be. So I just want to recognize that. I think it has a huge impact on the community, and I'm grateful for your willingness to do the work. Thank you.
Thank you.
Any other questions, comments?
I have a comment from our intrepid fiscal supervisor who is tuning in and has more information on the revenues, of course.
Thank you, Laurie.
So Lori just sent me a message to say that the Healthy Housing Grant is budgeted for $27,252 in revenue for 2023. So $15,000 of that is going to mitigation. The rest is going to Andrea's salary for implementing the program.
Thank you. Thank you, Lori.
Yeah, it's really helpful.
Lori.
All right. Well, I think that might be it for questions and comments. Thank you very much for the information. And
Thank you.
Very excited to hear about your first assessments and how that
I'm
goes.
excited.
So, yeah.
Thanks very much.
Have a great
Thank
day.
you so much.
Yeah, thanks, Andrea.
Thanks, Andrea.
That moves us down to item 5, our director's report. Allison.
I will start out with a brief staffing update. We are recruiting for 3 vacant positions at present, with 3 vacancies filled in the last month. You met Matthew and Laura this morning, and we'll be welcoming Michelle Dion on October 31st as our new social services case aide. We've been doing some planning work in event of Michelle coming on board. One of her primary functions will be working out of our front office, supporting front office operations in terms of directing phones and walk-ins. She will also be providing support to our social work team with a variety of clerical tasks, things like data entry, file maintenance, correspondence with the people we serve to allow our social work staff to spend less time doing data entry and correspondence and spend more time working with the people they support. We're also exploring developing this position to provide more technical assistance in SSIS, which is our Social Services Information System. We're also continuing to recruit for the Family Services Case Manager position. We have had to post this one multiple times with very few applicants who have direct experience working with families or youth. The Behavioral Health Clinical Supervisor posting closes this week and have some days identified for interviews the week of October 31st. Finally, our Licensor and Child Care Coordinator was also posted last week. So excited to be recruiting for that position as well. So still a number of vacant positions. We're starting to see more overtime within key teams that are under-resourced right now. So just want you to be aware of that reality for our team. If you don't have any questions on staff updates, I'll move on to department updates, including a COVID-19 update. All right. So after several weeks of being a low transmission county, for the last 2 weeks, CDC has classified Cook County at a medium level of transmission. This does mirror the trend of cases that we're seeing locally climbing to around 25 to 30 per week for the past 2 weeks. CDC and the FDA recommended bivalent booster vaccines for 5 to 11-year-olds last week. Similar to the adult bivalent boosters, these ages should get their booster at least 2 months after their most recent COVID-19 vaccination. PHHS is working with the Department of Health and Sawtooth Mountain Clinic to get pediatric bivalent booster events set up for the first weekend in November. We're also working with MDH to offer weeknight and weekend walk-in bivalent vaccination events for the first 2 weekends in November to help us better meet the demand for vaccination, as well as to provide more accessible options for people. More information about dates and times should be published later this week as we finalize that agreement with the state. Finally, a postcard reminder to remain up to date for vaccinations will arrive in mailboxes for all county addresses sometime this week. That was a partnership with the clinic and North Shore Healthcare Foundation to support that outreach effort. You heard from Andrea this morning that we're starting to offer the healthy housing assessments this week. We are also beginning to offer the Healthy Kids Minnesota screening program with individualized outreach happening now, along with ISD 166 and more general communication outreach planned in the near future. Last update on the public health end is that we're working with the Regional Community Health Board on a communications campaign to encourage families to keep up to date with routine well-child checks. That campaign will feature local faces and voices of families talking about why regular checkups are important to them. And that's something that we're working on with the support of our new communications specialist at the Community Health Board. Keep us moving on to human services updates. The state and DHS have completed their RFP process to determine managed care plans for medical assistance enrollees beginning in January 2023. We will see some changes for next year's. So I'll note those now. Children and families enrolled in a prepaid medical assistance plan will have the option to enroll in either Blue Plus or UCare. Currently we have Blue Plus and Health Partners. Special needs basic care, which is a managed care service for persons with disabilities age 18 to 64. Those plans are changing to Medica and UCare. Currently we have Health Partners and UCare. And then for seniors enrolled in Minnesota Senior Care Plus or Minnesota Senior Health Options, will change to Blue Plus and UCare, and that is no change for the current plans for those populations. These changes in plans are reflected on the annual health plan selection notices that have started being sent out by DHS to residents earlier this week and late last week. And we will be conducting more outreach to help explain these updates to community members who have changes about the health plan availability in Cook County. In the adult and home and community-based services realm, we received notice from the state that we were awarded additional funding through the Coronavirus Response and Relief Supplemental Appropriations Act. So our grant amount was $778 for 2023. And these funds must be dedicated to support adult protective services. So our spending plan, which we submitted and received approval on last week, is allocated to address one of our most commonly reported but difficult to resolve issues impacting vulnerable adults in our community, and that is self-neglect concerns involving hoarding behaviors. Funds will allow PHHS to assist adults referred through Adult Protective Services with things like temporary lodging and other expenses, including refuse removal, pest control, and other cleanup and sanitation services to allow vulnerable adults to return safely to their home environment. So anticipate having a grant contract for approval at our next meeting in November. Excited to share that our behavioral health staff are offering 2 community-based support groups. This fall and winter, one of the groups focuses on restoring safe connections post-COVID. That's an open group every week at the hub. People are welcome to come and drop in at any time. You don't need to be a part of the entire series. And the other is a group that's focused on grief and loss concerns. We have several DHS audits underway, including SNAP, the Supplemental Nutrition Assistance Program, looking at our customer service and program access. ICWA, the Indian Child Welfare Act, we're meeting with DHS staff later today to receive some technical assistance to ensure that we're documenting things correctly and able to demonstrate compliance in the social services information system. And then in early November, we have our Rule 13 audit scheduled with DHS, which looks at our licensing programs. Finally, we again received a Certificate of Achievement for Application Processing Guidelines from the State Department of Human Services for Q2, and this is with regards to our processing of applications for SNAP, both expedited, so those applications for households that need immediate assistance due to their income, assets, and household expenses, as well as the standard processing timeframe, which is 30 days. So big kudos to our economic assistance and front office teams for helping achieve that continued excellence in that area.
We can only do that if we're properly staffed. Otherwise, yeah, things build up too quickly. So, thank you, staff.
So unless there are any questions, that might be a good lead in to reading the proclamation from Governor Walz recognizing October 12th as County and Tribal Financial Worker and Case Aide Day. I'll jump right into that. So this is the proclamation from Governor Walz. This is an annual occurrence in which financial workers in county and tribal service agencies are recognized. So I'll just read it. Whereas county and tribal financial workers and case aides are dedicated to providing outstanding service to the people of Minnesota through their administration of public assistance programs, county and tribal financial workers and case aides are responsible for the prudent processing of millions of dollars annually and must meet high standards of job performance in determining eligibility for public assistance, and the duties performed by county and tribal financial workers and case aides require that they be well-versed in several areas in order to effectively provide services to clients and the general public. And the nature of federal and state legislation necessitates that county and tribal financial workers and case aides continually expand their knowledge, skills, and expertise related to their profession. It is important to recognize the valuable services county and tribal financial workers and case aides provide for Minnesotans by always delivering culturally responsive case management, accessible community services, and a person-centered focus.
Wonderful.
Thank you, case aides and financial workers.
Hear, hear. All right, that moves us down to item D, the budget update.
So this is informational only, not looking for any action at this time, but wanted to keep you all apprised of where things are at for our 2023 department budget, most notably reflecting that change in planned use of fund balance and the significant reduction of that with the reconfiguration of our licensor position to include that child care coordinator function. So that is reflected with the reduced salary cost as well as the rescoring of that position to the lower grade, which you all approved at last week's Board of Commissioners meeting. We also have removed the contract cost for MTM, that's Midwest Transportation Management. That was a organization that we were exploring contracting with to run our healthcare access and medical transportation system. We just felt like we didn't have enough information to ensure that contracting with this entity would expand and not hinder the current services available to county residents. So we're putting a pause on that, keeping open mind for the next contract and budget year, but at this time moving forward with continuing to provide that in-house. We have reduced the fund balance, as I said, and then updated the Child and Teen Checkup Grant Award to reflect an increase in our grant that we're receiving from the state.
Any questions there for Allison?
I don't have any questions, Mr. Chair, but I want to thank you for this hard work, because since I've been a part of this group, I cannot believe the complexities involved in managing this budget and in moving things around so that we can serve the people here in Cook County. I think it's just an unbelievable job that you and your team is doing. So thanks.
Thank you, Pat. Thank you, Allison. It is very impressive, just how all the moving pieces have to come together, and always looking for more resources and then being responsible for the resources that we have. So thank you. Commissioner Hawkins.
Yeah, thank you, and I appreciate your willingness to answer my questions about the budget. I still have a couple left, but that doesn't need to happen here. But I want to thank you for being willing to explain a very complicated budget. But I will share with the board, I did share with Allison also, my frustration with the state. You know, I read, hey, the state's put $93 million into services, but it's not reflected in our budget, because it doesn't, what we get here at a county level, really, I don't think the funding system is fair, and I think we need to acknowledge that to our legislature and say, wait a minute, it's not fair that you keep adding all these things that we need to do, and it's more expensive to do it in rural Minnesota than it is in Dakota County. And we need to acknowledge that they need to step up to the plate, and it should be reflected in, out of that $93 million, we're budgeting the same or less from the state government and the federal government. And I don't think that's fair. So there's mine. So thank you for answering my questions, and I'm going to fight this. I think we need to be talking about this. It's not fair. They can talk, oh, we gave $93 million, increased funding $93 million, and it's not reflected here at the county level. So there's my soapbox.
Well said. Well said.
Good point.
Thank you. Commissioner Storlie.
Thank you. And to Stacy's point, I'm on the Health Committee with AMC, and that needs to be reiterated every time we meet, because that's the beginning of AMC maybe supporting us, and then going on to the legislature, which we will in February. So, right on.
Thank you. Administrator Yorkie.
Yeah, I just wanted to say thank you to you, Allison, and to Lori Erickson and the whole team for the clear way in which you've presented these changes. Transparency in our budgeting process is very important, and you've just laid this out in a very clear way that despite the complexity of the budget, anyone can understand.
Right.
So thank you for that.
Thank you, Allison. Any other questions or comments, or doesn't look like it? Very good. Well, that moves us right down to board action, which moves us right down to committee reports. The first one is the Active Living Steering Committee.
And we did meet on September 6th, and mostly just updates on activities that have been ongoing with, like the Safe Routes to School, the pathway going up to Great Expectations, and you see the asphalt is down, it's coming together. So even though we're late in the season, it is wrapping up, and I was very pleased to see that. Otherwise, updates from, the Gitchigami Trail Association on efforts they're taking to try to stabilize the areas around our new section of trail here. And a lot of discussion on, how to try to keep that in as good a condition as we can, both here, the new sections down on the west end and that type of thing, working with the state and DNR to ensure that the right activities are done to maintain what we really appreciate with these new sections of trail. And really those were the highlights. Had a lot of other discussions around various things and bike lanes downtown and different things like this, and signage that we always seem to kind of revolve around, but haven't landed that one yet. But that's it.
Thank you, Commissioner Svaleson. Moving on to AEOA, Arrowhead Economic Opportunity Agency. I have nothing new to report there. I think I told the board last month about the frozen meal opportunity that,
Yes.
Yeah. So I don't have anything else to report at this point. We're going to be meeting, I think it's next week. That moves us down to Arrowhead Health Alliance, and Let's see, I'm not sure if I informed the group that, the funding formula was, I know I informed the group of this, the funding formula is going to be changing, and there was a lot of concerns about that, and it didn't appear that DHS was considering the funding that was given to our region for when Moose Lake facility closed. The most recent formula looks like we will be okay, and dare I say, even in good shape. So that's encouraging, but I don't think it's a done deal at this point, and I'll keep you posted there. But as far as our crisis response is concerned in the region, that's going well with that transition to 988, and just having first call for help in our region, already doing that. Having that service go with them has been quite successful and working very well, as smooth as it can be. It's my understanding. So we had a little briefing on that. Let's move down to the Arrowhead Regional Corrections.
Oh, yeah, that's me. I was not able to attend the last meeting, but Chairman Deschamps was there, so that was nice that he was there for the ribbon cutting ceremony. They did discuss during their meeting lack of state funding. It was in the tax bill, but it didn't make it through. It didn't get passed. Another issue. And the tribes were there talking about the importance of community corrections, parole officers at the local level, and we were hoping the money from the state was going to come through to help support that. It didn't, but hopefully this next year, I heard maybe after the election there might be a special session. We'll see. But that's all I have to report from that.
Thank you. We'll just down to the Community Health Board, and let's see, Allison gave a little briefing there on the communication efforts and how that's coming together, and that's kind of the first project, and just trying to get roles figured out, and some of those ideas that the state wants us to try and fail on or succeed, but to really go for it. So that's very exciting. And then from our medical consultant, we had a presentation on obesity and the different factors that, and diabetes, and just the different factors that go into that. And in our region, we have a lot of outdoor activities, and that's one of those factors that is really helpful in combating obesity and diabetes. And so still our youth are using screens more regularly and not getting outside as much, but we do have that opportunity, and so hoping to really leverage those and to encourage it more. And I think our community does a really good job of that and continues to do a really good job with the Active Living Steering Committee and Safe Routes to School being some examples. But just our community's emphasis on outdoor activities, I think, is really, really helping in that front. And that also goes just to mental health, too, the importance of being outside and having outdoor activities, how important that is. So it's all connected there. Cook County Local Advisory on mental health.
Okay, we met a week ago, and we had a guest presentation from Carrie Anderson in Silver Bay, and she is working on mental health first aid. She's a mental health first aid instructor, and they have groups where people can come and learn what risk factors are, warning signs for depression, also substance abuse, any kind of mental health things. And then I think these people who are trained can then go into their communities and help, be aware of these things and work with people. So that was very impressive and good for people who, don't necessarily have to have a degree in mental health or anything, and they can learn how to help people and feel good about that. Is that summarize it pretty well? Okay.
I would just add that our public health team submitted an application to the North Shore Healthcare Foundation to support bringing training at no cost to county residents through the mental health first aid program. And this is also a component of our work plan for that large federal grant from HRSA for substance use disorder prevention, treatment, and recovery. So something that we'll be looking at partnering through that initiative as well to increase access to mental health first aid training.
And I'm sorry, we also talked about that at our district meeting too. And there was a point that was made at the district meeting that they weren't sure that this program is available for public safety officers, law enforcement, but there is a module for that, we learned at the Mental Health Advisory Council. And then also, our hope as a group was also to involve the school in this and to really start where things start, right, in youth. So, but it was a really encouraging and exciting program that hopefully our community will latch on to.
Yeah, and as a group, we want to help the schools if we can, you know, and the people, we know everybody's so busy, it's hard to even expect them to come to one of our meetings, but, you know, to give them more resources and how to prevent things and be aware of things. So it's good to have that relationship, and I think there's a willingness there. It's just sometimes a scheduling thing to get people together. And I don't know what else we talked about. There's teen mental health and adult mental health courses available. And I think that's about the main thing that we talked about.
Yeah, that was probably the bulk of it, was the mental health first aid and the different modules that are available. There's kind of the basic with adults, and then going into the teens, and then going into the child mental health as well, and then law enforcement, fire departments, veterans. I thought there was another module in there too, but it seemed like nearly everything has the module there, so really good tools.
Emergency services, is that in there?
I don't know if it's separate, but.
What was that?
Emergency services, I'm thinking ambulance
Well-
drivers, EMTs.
Oh, yeah, I think
Yeah.
maybe there was.
Yeah.
Yep. Yeah, I just can't remember that whole module list, so. Thank you, Rana. And then we have the restorative justice. Commissioner Hawkins.
Let's see, restorative justice, we have a meeting tomorrow, a task force. They're going to have a task force about truancy. So.
Oh, good idea.
Group of people looking at how we can address truancy in our schools. So I'll have more to report next month on that.
Then we have the Council on Aging, Commissioner Sullivan.
Well, there's a lot of buzz in the community about the need for a place for first and second thrift store. That building, they are able to stay there till December 31st. So that arm, if you will, of Cook County Council on Aging is looking for a space. And it's a very needed service that's provided to the community. So we just want, if anyone knows of a place that can be rented out, to please contact either Ann Michon or Lois Johnson, so that we can get something like that rolling and get it in place for December 31st to make that transition. Next item, emergency preparedness. We did not meet. We're kind of getting towards that, moving from pandemic to endemic, so we aren't meeting every month. We're back to meeting every other month. So that feels good. But obviously there are still needs and lots of conversation around the pandemic and also fires.
That moves us down to the Healthcare Planning Committee, Commissioner Storlie.
Thank you. They did meet, but I had 3 meetings that day, and I chose to go to a different one. My very first Rural Child Care Innovation Program, and that was pretty exciting to be part of that. Introductions all around, and not a lot of reporting, as there was some people who weren't able to make the meeting, but more to be discussed in the future. And I think one of the statements that I pulled out of there was, child care in homes is a professional business.
Exactly.
And we need to understand that. It isn't just a babysitter. It is and will be always a professional service. So that was my first meeting. I look forward to more.
thank you for stepping up there and representing us there, and, yeah, very excited for the work there as well. Thank you.
Then moving on to NACO, we do have a new president of NACO, so he was introduced in September, and we're now moving to Teams to meet, which I really like that a lot better than either you phone in or you do Zoom, and there was some technical trouble, so it's very hard to be on a phone to Washington DC. It's a lot easier to be on Teams. And so it's the same, you know, at the federal level, mental health for adults all across the board, inmate concerns, concerns about pregnancy and certain ethnic groups. We only have 35 or 40 issues to go through by December.
Oh, okay.
Okay, so we will sort all that out so that in February, when NACO meets their general meeting in February, then we'll be able to sort more things out.
Thank you, Commissioner Storlie. That moves on to the Northeast Office of Job Training. I don't think I have anything for the report. Haven't met since our last month, and the same is true for the North Shore Collaborative. That's going to be coming up here in November. And that moves us right down to the Public Health and Human Services Advisory Council.
And I have no new report there.
Yep.
So we haven't met.
Didn't meet. Last one is for the good of the order. I wanted to share something, and I can't remember the organization's name. It was out of Duluth, and it was at the Duluth Area YMCA board meeting, which I attend virtually. They all are in person, and then there's me on the screen. But sometimes, like our board chair last time was on the screen, so that wasn't so awkward. Oh, but it's the Damiano Center in Duluth. I don't know if anyone or everyone's familiar with that. I was not. I had heard of it, but not all that's provided, and it is mind-blowing. Providing meals every day for the needy in Duluth, providing clothing every day. They also have outdoor shower facilities and just hygiene stations, and they have specific clothing for job interviews. They have specific clothing for if you get a job, just to stay professional looking and having the right clothes for that. And also just household goods that are needed for people to have the dignity when they have a place to live, to have their belongings, and they really assist with all of that and more. Is just very, very impressive, and got to learn a little bit about the history there too, and they're celebrating 40 years, so that's incredible. Their biggest need, honestly, is men's clothing. So that was interesting to know. They said they have to turn clothing away in general unless it's men's, just because they have so much of the others. And just
Commissioner Reynolds, is that any kind of men's clothing, or is this for any kind? Great to know.
Any kind of men's clothing, yeah, yep. So, but it made me think of our budget shop and First and Second and Odds and Ends and just the resources that we have in this community, how impressive that is. And it also made me think of if there's ways to do more or provide more for our community, just because it's such a powerful resource, the Damiano Center. I know at the Hub they have pretty darn affordable meals every day for lunch. Just have to register before 9:30, and that's a wonderful opportunity. But then for clothing and such, I know the various entities have lots of options there. So, but it is distressing to hear about the need for location for First and Second. There's my ramble for the morning, or for this meeting. Are there any other items for good of the order? Else, I'd entertain a motion to adjourn.
I'll make the motion.
Thank you, Commissioner Svaleson. We have a motion to support. Rana supports. Thank you, Rana. We are adjourned.
Oh, that's one of the fastest ever.
Yeah, wow.
That's good.